From Via Benefits by WTW, welcome to Ion 65, a podcast for employers and plan sponsors looking to elevate their retiree healthcare benefits.
Hi, Barry. Thank you so much for being here with me today. How are you?
I'm fine. Hello, Nina. Thank you for inviting me.
It's my absolute pleasure. Barry, by way of introduction, could you tell our listeners your full name as well as what you do here at WTW?
Absolutely. Barry Carlton. I've been with WTW since 1988 in the health and benefits practice for about 35 years, consulting with employers on all aspects of active and retiree welfare. Early on, for some strange reason, I found an affinity for Medicare and other aspects of retiree medical. Started pursuing work in that area and found that there was quite a bit to do to keep me busy and occupied. A couple of years ago, I actually retired from health and benefit consulting, retired for a short period of time, enrolled in Medicare, and then returned to work at WTW in our individual marketplace, focusing exclusively on retiree medical at this point in my career.
Well, we're incredibly lucky that we have someone who's passionate about retiree medical, as well as someone who's gone through the experience themselves. So it brings that extra layer of expertise. Thank you again for being here today. So what brings me to inviting you on Ion 65 is the recent legislative changes introduced by the Inflation Reduction Act of 2022. And if you could just acclimate our listeners to what those changes were initially, and then we can get into some more of the specifics and details of what that means for plan sponsors.
Sure, certainly. And for that, I'll focus on the changes affecting Medicare, pharmacy in particular, and probably the most significant set of changes to the program since its inception in 2006. One, the public headlines. The government is now negotiating with pharmaceutical companies on the price of certain high-cost Part D drugs. That effort will expand over time to additional drugs in Part D and Part B. But the short story is that the pharma industry is being asked to contribute more to the financial welfare of seniors through their prescription drug program. Within the plan itself, the major changes coming in 2025 include a new, much lower out-of-pocket maximum, replacing the very confusing array of provisions in Part D prior to 2025 with a new and much simpler design that has, at least for standard coverage, a deductible coinsurance level that is typically going to be provided through equivalent copays and coinsurance with caps, and a $2,000 out-of-pocket maximum, so no one will pay more than $2,000 out of pocket next year. Within that, these benefit changes that enhance benefits for seniors in Part D, there are fundamental changes in the underlying financial picture on how insurers are compensated for providing Part D coverage. Of course, some of the funding sources has to be enough for them to be able to earn reasonable profit when considering the premiums they collect from retirees, the out-of-pocket costs paid by retirees at the pharmacy, and then the funding that comes from the federal government and the pharmaceutical industry, again, to help balance the books on Part D. So the visible changes, very favorable to retirees, improved benefits, a lower out-of-pocket maximum. Some pre-existing changes include a cap on the price of insulin and expanded coverage for vaccines. But the big change in 2025, the new out-of-pocket limit, the much simpler plan design, and also really a very important program for many seniors called the Medicare Prescription Payment Plan, M3P, which is an option for all members in Part D to elect to spread their out-of-pocket cost out over the course of a year. Free to sign up, easy to do. If seniors sign up for that provision for 2025 at any point, then they'll pay nothing at the pharmacy, and their remaining balance will be billed to them according to a federal formula over the balance of the year. So another provision that doesn't change the retiree liability, but helps retirees manage and budget better through the year. So another pretty important provision in smoothing out costs as well as lowering costs for retirees. So a big package of change benefiting the 50 plus million people in Part D. A lot of complexity for the insurers, for employers who are sponsoring group Part D plans, and for all the administration related aspects to make all this work properly.
So Barry, it sounds like to anyone who is even remotely familiar with the changes that the IRA has had specifically to Part D and healthcare, that it really has a lot of benefit for retirees. What kind of implications that might not be immediately apparent should plan sponsors be thinking about?
Employers who sponsor group Part D plans. So let's go back a little bit to the creation of Part D in 2006. It came out of the Medicare Modernization Act passed in late 2003. When the program was created, the legislators understood that many employers provided prescription drugs to their Medicare seniors, and they elected to include provisions to encourage employers to retain group-sponsored plans for their post-65 pharmacy. And they did that through a couple of different avenues. And one was what was called the Retiree Drug Subsidy Program, which is still in existence. But a much more popular approach was for employers to sponsor their own custom group Part D plans. So if we speak of the employer as the sponsor of the group Part D plan, there are some specific implications for those employers here. So as the sponsors of the plans, and these are often self-insured, those employers are paying the claims. They're responsible for covering the cost of the drug less whatever copays apply to their members. The challenges here are that with the remixing of the financial components, employers who've been relying on the funding toward EGWIPs that they receive as EGWIP sponsors from CMS and the pharmaceutical industry, same as insured Part D plans, that formula is being upset in a way that's hard to predict. And so employers don't know for sure how they're going to fare financially in terms of the reimbursements they receive behind the scenes from these sources. It's kept actuaries and consultants and others busy in trying to predict the future, but it's especially challenging because A, we have an inflationary environment already, and that affects the cost of healthcare and prescription drugs. B, we have these benefit enhancements that apply to all seniors on Medicare Part D. When you enhance benefits and reduce the cost that people pay, they start to utilize drugs differently. C, we have the government's role for the first time in negotiating pharmacy prices, which will have some uncertain effects. And then D, employers are left wondering what all of this will mean for them financially over time. What will it mean for the accounting obligation they hold on their books for their retiree medical liability? And what might it mean for their prospects of managing the program effectively in terms of the financial impact of these changes? Will they need to change terms for retirees as far as design or cost sharing in response to some of these potential pressures?
So for plan sponsors of group Part D, they've probably heard about this by now, and either they have been preparing for it or they're maybe sitting in a little bit of this limbo. As you mentioned, there are these unpredictable factors. What would be some of the recommendations that you would give to those particular employers who haven't maybe taken action yet?
I think most are aware of these changes. They're hearing. Employers who sponsor EGWIPs are pretty much all working with the PBMs who administer these EGWIP plans on their behalf. And I think these employers are hearing from those PBMs. They're certainly hearing from consultants and advisors and others in the marketplace. Given the uncertainty, some employers may be stepping back and saying, all right, let's let this unfold a bit and get more of a sense of how all this might affect us in terms of the cost of our plans and the value of the reimbursements we obtain from these other sources. And my response to that would be that may be okay if you're not under significant financial pressure. But if you are under pressure, if you're an employer who, like many, has taken steps to curtail your eligibility and commitment toward retiree medical, a cost surprise may not be welcome. and may trigger a need to take a closer look at your plan terms to determine if your current course is sustainable or not. Some employers who are deeply committed to continuing to sponsor these group plans and are well positioned financially to absorb cost shocks may step back and wait. But most employers probably aren't in the boat where they can just sit back and wait to see what's going to happen. So many employers have taken some action, and others will consider action over time, especially as the real world impact of these changes starts to become known as we move into 2025.
For EGWP sponsors who are on a traditional 1-1 plan year and they decide
Mhm.
to take this let's wait and see approach, is there
Mhm.
anything that they could do, even if they are on a 1-1 plan year, that where they see action might be needed to be taken sooner rather than later? What would you recommend to that type of employer?
Well, that's a hard question to answer, Nina, because the real world impact won't become known within a few months. Again, I'm speaking about the EGWP sponsors who are largely self-insured. They're paying the claims, they're receiving the reimbursements, they're paying a PBM to administer the plan. The new flow of money won't become really clear for probably a couple of years after 2025 starts. And so many employers won't have the luxury of waiting to see how this looks and may need to consider action based on reasonable, educated projections. Will projections get a little better once we have some of 2025 under our belt? Probably. Will they be as clear or precise as employers might like? Hard to say. We're in a period of extended uncertainty here around the financial impact of these changes, and it will take a minimum of several years before it really starts to settle down and become clear to the Part D community, insurers, employers, and members what all of these changes mean long term.
Obviously, there are cost pressures, especially for employers who might not have that financial padding that would be really nice, that cushion to have
Right.
in this time to wait it out a
Mm-hmm.
few years. Besides the cost pressure, are there any other types of risks that employers should be thinking about?
We think in general, employers should be thinking about risk at all times throughout all aspects of business, including certainly self-insured retiree health care. It presents a significant number of financial risks, and the financial wherewithal to withstand those risks may be more limited. What some employers have done to address the unknowns and the risks in the retiree medical world, especially if they're moving away from their commitment longer term, is they've looked to an individual market approach, an approach by which they cease sponsoring group plans, turn the risk over to the insurance carriers themselves, and help their retirees elect individual market plans. And that's one of the other really key trends here, that over time, as legislation has improved Part D, it's also improved Medicare Advantage plans and created a marketplace for insurance for people of all ages with the ACA. So what that means is that many employers who started sponsoring group plans in order to fill the gaps that existed in the individual market are now in a position where the individual markets for all ages have gotten very strong. Enrollment has grown. Underwriting pools are stable. We all know the stats about the number of people becoming Medicare eligible every day as the boomers retire. We know that the enrollment in the ACA is up to its highest level and is showing more stability. Central question for some employers is, if you've been sponsoring group plans to help fill some of the gaps that existed in the individual marketplace, and many of those gaps have been filled now by legislative action, not least the Inflation Reduction Act, filling in the remaining gaps in Part D. What's the rationale to continue group plan sponsorship? Some employers will say, that's our business, we're committed to it, we have agreements, we have no desire to exit group plan sponsorship. But others will say, if the need for group plan sponsorship is not there the way it used to be, then we ought to consider alternatives. And that's one way of very effective risk management, shifting that risk onto the insurance carrier world and frankly, the government and the taxpayers to deal with the cost and uncertainty relating to continuing benefit enhancements.
You brought up a point earlier too about promises being made to retirees.
Mhm,
So, using the suggestion here that moving to an individual marketplace model could be a great solution in this
mhm,
particular instance. Sometimes I hear in talking with plan sponsors and even with retirees is when they hear about a big change or big overhaul in what they're used to, especially from the retiree perspective,
mhm.
that they say, wait a second, hold on. This is what I've been promised. And now all of a sudden you're taking your promises away, your benefits away. And there can be a lot of fear around that. How would you address that?
I would never minimize the concern that retirees might have about change and the fear employers may have about imposing change on retirees. It's a difficult area, and retirees like certainty and would prefer, in many cases, for things to stay the same as they are. But having said that, many employers have made the change that I'm talking about, including many very well known large employers in the country, have made the change by saying, we no longer need to be involved in delivering benefits when the individual market will take care of that. We may give you some money to help with that purchase. These plans are insured, they're highly regulated by the federal government and by the states. Consumers have protections available to ensure that these plans meet their needs. And many employers have found that once that change is made, the adverse reactions weren't what they thought they might be. Retirees, for the most part, are able to find coverage that works for them. In many cases, coverage that is more favorable than what they had through their employer. And with that, retirees may say, yeah, that wasn't so bad, especially if they have a competent third party helping them make plan elections and making the process of evaluating and enrolling in plans easier. But for some employers, especially those who may have groups with unclear reservation of rights, those employers should tread carefully before making changes. But most employers have known that it's imperative to retain rights to change their plan, but these changes can be made and they can be made in a way that does not need to be adverse to a retiree's interest. Most retirees will end up just fine after this type of transition to the individual market. Not everyone will call you with, send you favorable cards and flowers and letters and candy. Not everyone will do that.
Well, earlier you also alluded to funding for this. I assume you mean in the form of an HRA?
Yes, a health reimbursement arrangement. So the government created this arrangement a couple of decades ago. It's really very, very flexible. It gives employers a great deal of latitude to do many things. HRAs are often embedded in active healthcare plans as a vehicle to provide some upfront funding controlled by the consumer. But in the retiree world, we can disconnect them from the plan. That's the beauty of this. An employer can say, all right, I'm going to give my retirees $2,000 a year in an HRA that they can use to offset premiums and out-of-pocket costs in the individual market plan of their choice. The employer is still sponsoring a plan. The HRA is still an ERISA plan. The employer's risk is limited to its $2,000 contribution in this example. There's no more insurance risk. Administration is drastically reduced because you're only funding an HRA and you are not contracting with insurance carriers and managing insurance plans. So the HRA is a tax favored, very flexible vehicle that employers can use to shift their funding, disconnect their funding from the plan election that retirees make. Retirees can now use the funding toward the plan of their choice, and thereby increasing the flexibility for retirees to make good decisions without the employer telling them, here's the plan that you get, and you need to take this plan to get my funding.
You bring up a good point around choice. A lot of retirees end up moving, for example, away from
Mhm.
maybe where they were actively employed. Maybe they're snowbirds and spend time
Sure.
half of the year in one place or another.
Right.
So, having that choice, different networks might be something that's really important and valuable to them. So,
Mhm.
just to summarize, what I think I hear you say is that there's a $2,000 funding option in a tax favorable HRA
Or
that
whatever amount the employer chooses to
okay, so it is
provide.
a flexible amount. It could be
Totally.
any amount that the employer so chooses. They mitigate their risk. They also lower or eliminate their administration burden. very substantially, and provide the retirees choice, and they're still fulfilling obligations or promises that they had made, even if it takes on a different form.
We're changing the way that they provide the benefits and shifting from the plan we've designed with the funding we've allocated, take it or leave it, to a funding option that people can use to pick the plan that works best for them based on where they live and the type of provisions that matter the most to them.
So we're about out of time. If I could ask you, if you were to hop onto an elevator with a plan sponsor and you had 30 seconds in the elevator with them, what would you tell them about anything about what we just discussed?
It's a great time to take a look. If you haven't reviewed your plans for some time, the changes in the environment create great opportunities for employers to consider alternatives to the status quo that can take advantage of the developments legislated by the government and help employers reduce cost and risk.
Well, Barry, thank you so much. I hope that for our listeners that you were able to break down what to me is a very complex and nuanced subject. And of course, if they have any questions, they're always welcome to reach out to us through our website and follow up with any questions specifically for you that can be directed to you as well. Is that correct?
Certainly.
All right. Well, great. Thank you again for being here. And thank you to our listeners for being here as well.
Thank you.
You've been listening to Ion 65, a podcast by WTW. For more information on VIA benefits and the solutions we provide, visit OptimizeRetireeBenefits.com. That's OptimizeRetireeBenefits.com.